Hi there. Today we're going to start a new series on sleeping problems. This is one of the most common problems that people present with to their doctor's office, certainly in the primary care setting, and has a broad umbrella of things that it covers. We're going to try to nail some of these things down and try to get you some help so that you can get a good night's sleep. First question to ask is, why are you not sleeping well? There are many causes, and so nailing that down can be critical in figuring out what steps we can take to get you some solutions. One, are you taking medications that may be interfering with your sleep cycle, like stimulants, either for weight loss or for ADHD? Is it depression or anxiety? In which case the sleeping problem may just be an offshoot of the underlying issue, and treating that helps the sleep problems. Are you the kind of person who was just born a bad sleeper? Is that your factory default setting? We can work with that too. If it's been your whole life, that may be more the issue. Do you have bad sleep habits? That could be a problem. We're going to spend a whole segment addressing sleep hygiene. Do you have underlying medical problems? Perhaps urinary issues where you're having to get up frequently to go to the potty overnight. Do you have restless leg syndrome or perhaps sleep apnea? You can refer back to my sleep apnea video on that one. Do you have a chaotic environment? Is there just too much going on in the household? That could be leading to anxiety or just disruption. Do you have pain or shortness of breath potentially? All offshoots of an underlying problem that may need to be addressed. Do you have too much caffeine or alcohol in your life? Those can also interfere. So we need to take a good questionnaire before we really delve in and figure out what the problem is. Sometimes making a few little changes can be very helpful. Any kind of a sleeping problem can lead to a multitude of problems downstream. For one, you're probably going to be cranky, and nobody wants to be around a cranky pants. Two, your decision making can be impaired, your executive functioning, and things like driving or operating machinery could be dangerous for you and other people. Can also lead to mood disorders, depression or anxiety, and many other problems.
I'm tired, boss.
Also, if you're excessively tired, especially in the elderly population, sleep deprivation can lead to risks of falling, especially at night, which can have devastating ramifications. Next, are your expectations of a good night's sleep realistic? Most people age 18 and over need 7 to 9 hours of sleep at night. Much more in the teenage years because there's a lot of remodeling and growing going on there. Age 65 and older may need a bit less sleep, more like 6 hours. And a lot of people have in their mind that they need to get 8 or 9 hours of sleep every night, and they put a lot of pressure on that. And when the pressure builds, it makes that good night's sleep less and less likely, harder and harder to achieve. So let's set some realistic expectations of that.
You go to sleep.
Strategies to help your sleep without medications include decreasing your alcohol intake, decreasing your caffeine intake, certainly limiting it to earlier hours in the day if you just really need a cup of coffee to get going in the morning. Hopefully we can avoid that by fixing your sleep problem so that you're not tired to begin with. Drinking fewer fluids in the evening can really help if getting up frequently to go to the bathroom is your problem. Minimizing noise in your area, keeping your bedroom nice and quiet, and helping your body calm down before bedtime. Not having chaos in the evening lets your body calm down as the sun starts to go down. Some people find counseling to be very helpful for sleep problems. CBTI, which is cognitive behavioral therapy directed toward insomnia, can be very helpful for some people. If you are anxious and just have a lot on your mind, sometimes journaling can also be very helpful. You write down your concerns and then literally close the book on them before you go to bed. That can help declutter your mind and allow you to sleep. Minimize looking at the clock. because people lay in bed and think, okay, it's 4 o'clock. If I go to sleep right now, I can have 2 hours of sleep. That just builds the stress and makes your good night's sleep less and less likely. Also, you might talk with your doctor about adjusting the timing of taking some of your medications and see if that may help increase the likelihood of a good night's sleep or decrease the likelihood that it may keep you awake. Now let's talk about medicines that can be helpful. There are some things that are over the counter that do not require a prescription, and so a lot of people try those. Melatonin is a substance that your brain makes. It's kind of like your natural signal to go to sleep. It's not a tranquilizer, but it gives you an off switch so you can turn off the system. Some people use an antihistamine such as Benadryl, diphenhydramine, because of its sedative effects. It's one of the safest medicines that we can get our hands on and generally doesn't interact with other medications and is not habit forming, and so is probably okay to use, especially if you have allergies, because you are getting a 2-for-1 there. Of course, you want to make sure that you don't have any other conditions that might interfere with, but it should be fine. There are several different medications that are not controlled substances and therefore do not have a risk of being habit forming. So we like to start with those when possible. Many of them are from other classes of medicines, and we notice that sedation tends to be one of their side effects, and so often they're used for that. Trazodone is one of those. It's an old antidepressant. It's not a great antidepressant, but it does make people sleepy. And so that seems to be really its main use these days. Others are amitriptyline, doxepin, and hydroxyzine, and they've all been used with great results. There's another called mirtazapine that tends to make people drowsy. I would say caution with this because sometimes it can increase your appetite, and so some people will see significant weight gain on that. Occasionally we will use atypical antipsychotic medicines. It doesn't mean you're psychotic, but they can be sedating, and so sometimes if someone is very anxious or irritable, that can be a nice therapy to try to help get them to sleep. Then we get to the class of medicines that are sedative hypnotics or tranquilizers. We really try to not use these first line because of their risk of habit forming or addiction, and they can interfere with memory issues and can cause sedation and increase fall risks. So if we use these medicines, we try to use them short term, and sometimes all we have to do is sort of reset your body's clock to help it get trained to go back to sleep. We can do that sometimes in as little as 2 weeks, and you want to do this with close supervision so that you know it's not becoming a problem. These are medicines like Ambien, the generic is Zolpidem, or Lunesta. There are some others. The older medicines like Valium or Xanax, which are the benzodiazepines, are also frequently used, especially if anxiety is part of your sleeping issue. There is a newer class of medications that help to activate the sleep cycle and turn off the wakefulness cycle, and they're very different because they are not sedative medications. It's just like they're equipping you with an off switch. And I think these really hold a lot of promise for us in the future. They're fairly new in the last 5 to 10 years. The first was Belsomra, and then there's a newer one called Quviviq that can be helpful as well. The technical term is that they work by blocking the wakefulness promoting neuropeptides. So now that you've had your little physiology lesson that you really didn't ask for, hopefully we're off equipped with some information to help us get some better sleep. Stay tuned. I'm going to talk about sleep hygiene next.